Okay, we're here at the mHealth Summit with Dr. Peter Hudson, who I met before here a couple months ago at the great CHDI Data Summit. How's it going?
It's going well, thanks, Alex.
Glad to hear it. So the app we talked about back then and that you're working on now is called iTriage. Can you explain a bit more about what it does and maybe show me a demo here?
Sure. iTriage answers two common questions for people. What could be causing the problem I'm experiencing? What's the cause of my symptom? And second is, where should I go? What's the most cost-effective, fastest, best, highest quality available service to pursue to get that treatment?
Okay, so take me through this. I just, let's say, use a perfect example. I broke a toe a couple weeks ago. Now let's say if I'd used your app, how do I figure out where to go?
All right, so we are going to start with a symptom. Yep. You can actually just pursue care from the first three buttons. You can look up clinical information on the second three, or you can access your health record and do a bunch of kind of tools that we've built for the user. But we're going to go and we're going to look up your symptoms. So let's look up toe pain. And then let's look up all of the causes.
Yeah.
Look up all the different causes. So, hammer toes can cause pain, a laceration, blood under the nail, tendinitis, but you think you might have a fracture.
Yeah, heard a snap.
So we can go in and we can learn a little bit about fractures. So what is a fracture? What symptoms should you experience? What tests might be done and x-rays necessary for that? What treatment might be given to you? So when somebody does offer you treatment, you have a benchmark to think about it. Let's look at videos of fractures.
I don't know, Doc. I'm hurting really badly. I think I want to go see someone at this point. I mean, I'm not sure. I mean, video is great, but...
All right, so you don't want to see that compound fracture.
I don't want to look at the compound fracture right now.
So iTriage is all about action and
Right.
taking action about your health care. So let's go find some medical care,
Okay.
and let's actually use a GPS location around us.
Got it. And you're using obviously a 3G iPad. I could use my iPhone, or you could use an
Correct.
Android phone as well.
Absolutely.
Okay.
So if you if you feel like you have a fracture that you want to be seen in an office environment, you can go and you can find an orthopedic surgeon in your area.
Yep.
And give them a call and book an appointment. And there's a lot to choose from in this area in DC. If you want to be seen acutely, you need to make sure that you find a place that has x-ray, and this is sort of a general fracture disease, so we're going to probably route you more toward the ER to get an x-ray, although urgent cares oftentimes have x-ray, and we'll be adding some of that data. So here's all the ERs around you.
Yep. Let's say I want to go to George Washington. That's actually where I ended up going. But in this case, I've heard good things about them from our friends, so maybe that's an option. And there's looks like a quality
so
report.
Go in there and get some quality information from one of our partners. I can call them. I can get a map and directions right from the app, and I've sort of gone from, a symptom. I guess I'm trying to log in here.
Sure.
Symptom to mapping and finding the facility.
So step back a sec. Here's an app that gives me all this information, but this isn't necessarily something that you've put together in terms of the data. Where is that coming from?
The data comes from a lot of different sources. We have partners that share data with us. We have every physician, every urgent care, retail clinic, hospital, ER, pharmacy in the country, and we also have every community center or federally qualified health center in the system as well. It comes through the government.
Now, that last aspect's key, right? The first context where I met you was actually the National Institutes of Medicine, where we talked about this community health data initiative, where they opened up health data, and that's driving a good part of the app and a number of other apps. What kind of information would enable you to make an even better app beyond what you have right now?
Well, I think with 30 plus million people coming into the primarily Medicaid healthcare system, it's going to be really important to help people think through their condition and get to the right kind of care. And if it's a low acuity problem, let's get them to a community health center. If it's something that's serious, let's have them start out in the ER. It makes a lot of sense, both from a quality standpoint and a cost standpoint. So what we'd like is those community health centers start to participate in iTriage and share information. What are your hours of operation? How do I book an appointment right through my phone? What kind of services do you have there? What specialists rotate through? There's a lot of information that could be very valuable to those not only 30 million plus people, but other people that are already using these centers. And we've had tens of thousands of searches for federally qualified health centers through iTriage.
Now, that's a lot of volume. What's the business model here?
Business model is the government is putting a lot of money into trying to get people to access healthcare in a responsible way by providing data, sharing that into our system, signing up for listing services on those community health centers and other government-related healthcare centers. I think it'll be more attractive to consumers. It'll draw visits. It obviously provides us with some revenue to help maintain, share, and deliver that data to the consumer right at their point of need.
And for iTriage, what's the volume of searches? Is this a paid app? Where's the money come from you all? Because I know it can't entirely be about altruism, right?
It's actually it's a free app, so it's free to everybody. We have quite a few users. We're in the top 10 of the app stores on a consistent basis. We're on a run rate of over 5 million page views per month on mobile. That's very targeted, very focused information. Users are sometimes going through and looking at 60 page views, trying to really ascertain what's their problem and how to search for healthcare. So our model is that hospitals, physicians, urgent cares pay to place media, information, real-time data feeds, and enhance their listing through our application. And then governments, populations, health plans will help pay to integrate their data into our application. What product has this network of physicians accessible to it? So
to kind of put that in a nutshell, then you're using public and private data stores and putting that into a searchable UI in an app, which people can then use to find the best healthcare options wherever they happen to be.
That's right.
All right.
If you get hurt stepping off a plane in Georgia tomorrow, you can find a place to take care of you. You need a cardiologist in California, same application, same process, and you can go through a pathway that connects you from the disease you're worried about right to the right kind of doctor.
And is that iTriage.com?
It's iTriage on all the app stores.
Yep.
It's iTriageHealth.com on BlackBerry and mobile browsers as well as web.
Well, Dr. Hudson, thank you very much for talking with me, and maybe I'll have to download iTriage myself so the next time I break a toe, I know where to go.
All right. Thank you very much.